Good evening, all, and welcome. I, Sundeep Akula from NATCO team. You are listening to another special episode of Respire, one voice at a time. Joint initiative by NATCO and Voice of Healthcare team. Respire, a podcast series navigating the health journey of lung and also its related cancer-related issues. So nothing but lung cancer nowadays. The most common cancer and also the one of the leading causes for cancer-related deaths in India. So to understand what is exactly it and to also clarify the myths and gaps, to understand that we have with us a renowned medical oncologist, Dr. Anuj Bansal, to throw some light and also the vital aspects which includes in lung cancer awareness. And Dr. Anuj Bansal is from Punjab Cancer Care and Multispeciality Hospital, a very renowned medical oncologist from Bathinda. Welcome, doctor. It's always pleasure to have you us on this Respire platform. Thank you, sir. Over to you.
Thank you very much for nice introduction.
Thank you, sir. It's always pleasure. So, coming to the to make us audience understand, sir, general audience. So, what exactly the burden of this lung cancer, if you see?
Lung cancer is the most
Incidence.
important cancer, most common cancer in India. And the incidence, if we see in 2020-22, it was around 81,000 new cases were diagnosed. So the latest data we have, 2022, that is 81,000. And it accounts for around 6% of all cancers. All cancer taken together, around 6% are because of lung cancer. And the mortality rate is higher, that is around 8%. 8% of all cancer deaths are because of the lung cancer. So the burden is too much.
Okay, sir. And sir, is it common in both smokers or any special risk factors are there?
Yeah, it's more common in smokers, but it's not like that. That only smokers can have lung cancer. There are many more causes for that lung cancer. One is genetic causes. Now we can see many genetic mutations are there which causes lung cancer, like EGFR mutation, ELK, ROS mutations, and one new PDL1 test we do for all lung cancer patients. They have a immune-mediated mechanism as well. And other causes, more smoking, except smoking, are air pollution, indoor as well as outdoor air pollution, and occupational hazards is also a risk factor, like exposure to asbestos. So it's not
Sir,
only
this
smoking.
non-smoking.
I'm
Thank
saying
you,
that
sir.
no.
You talked about the. So please.
Okay, fine.
Please.
Please, you continue. You continue. Yeah.
Sir, okay. Sir, one triggering point is that when you talked about this non-smokers, is the trend is really increasing, sir?
Yes, definitely. The trend is more in non-smokers now. Now we say around 40% of lung cancer is seen in smokers, and rest 60% is in other causes like genetic causes or air pollution. So it's not the smoking which causes lung cancer. Many more factors are there. And in non-smokers, adenocarcinoma is more common. In smokers, it is squamous cell carcinoma, and in non-smokers, it is more of adenocarcinoma. And the prognosis is also different. In smokers, the prognosis is poor as compared to the non-smokers. The survival rates are less.
Okay. And coming to the detection part, sir, is early diagnosis really crucial for the lung cancer patients?
Yeah, definitely. Early diagnosis is the very crucial because chances of survival is more if we diagnose in early stage. Because in early stage, like stage 1, stage 2, it is resectable. But unfortunately, we see more patients in stage 3 or stage 4. Around 70% of the cases, what we see in our practice are in later stages where the surgery is not possible or local treatment is not possible. So these patients are palliative patients. We can only prolong their life and we cannot cure them. So that is the big challenge we are facing.
So, what are the different screening methods or diagnostic tools are available for lung cancers?
Screening is not done in all cases. Only heavy smokers, which smoke daily, what we say 20 pack years, that is one pack smoking for 20 years or two pack for 10 years. In those cases, we need to do a screening, and that is low dose CT scan. In India, it's not we are not doing much these tests. In Western countries, it is regularly done, but in India, there is no national guidelines, and some places it is done. Most of the places, the screening is not done. So that is a big challenge. And
Okay.
awareness is also not there. Smokers, people also they are not aware that they should undergo screening test.
Okay. And diagnostic tools, sir? Any diagnostic tools
Diagnostic for
which?
screening, it is CT scan only. You cannot diagnose on X-ray. So for screening as well as diagnostic, initially we need to do a CT scan. If there is a finding, then we should get a biopsy done. The biopsy is the diagnostic gold standard test.
So we
In
know, sir,
biopsy again,
sir, please,
sorry,
please, sir. We know, sir, you see a
biopsy.
lot of rural patients at tier 2, tier 3 cities.
Yeah,
So
that is the problem.
in India, always there is a question of affordability. So whatever the diagnostic tools are currently available is affordable for those kind of tier 2 patients or
Uh,
tier 2.
yeah, rural people they don't have much money, so getting a PET scan done, biopsy, and then genetic workup is very difficult for us to be done in these cases. Some government support is there, but it's not that everything can be done with the government support. So this is a big challenge. Mainly getting a genetic workup for these cases is a big challenge for us. We are not able to get it done. And the treatment part again based on the that genetic workup, or if you wish to give immunotherapy to the patient, the affordability is not there. That is a big challenge to us.
Okay. Okay. Okay, sir. We talked about diagnostic tools. And coming to the signs and symptoms, sir, which are the signs and symptoms which should not be ignored? And
Normally, sign and symptoms they matches with the simple chest infection like pneumonia or tuberculosis. So if the symptoms like cough that is persistent for more than 3 weeks, patient having blood in sputum, or there is a chest pain, heaviness in the chest, breathlessness, these are the main symptoms. What we see in general. Sorry, Mr. Olak, I think my network issue was there. Am I audible? Mr. Olak?
Sir, you are audible.
Oh, thank you. Thank you. Thanks a bit. So we're discussing about symptoms of lung cancer. Uh, Symptoms are almost same as we see in simple chest infection or in a tuberculosis. So because of this problem, we normally miss the diagnosis of malignancy, and awareness is also not there. So sometimes patient come with a cough or breathlessness. We treat as a simple chest infection, or we treat these patients for tuberculosis. And after 2-3 months, if the symptom doesn't subside, then we evaluate for other diseases. Then we get a CT scan or X-ray done, and we come to know that this is a malignancy. And so the issue is delaying diagnosis because awareness is not there.
Okay, sir. So, okay, sir. Coming to the treatment part, so you have been so many expertise, sir. I think last 20 years or 10. If you see the treatment evolution, how does the treatment evolution has changed in the lung cancer, sir? Starting.
Sorry, is it fine? I'm audible. I'm visible to you, Mr.
Yes, sir.
Olak.
Yes, sir.
Okay. You are asking about treatment landscape. So treatment landscape definitely changed a lot in last 10-15 years. In 2004 or 5, we are mainly treating these patients with the chemotherapy. So there was no targeted treatment available. And later on, some targets we came to know, like EGFR, ELK, ROS, and specific to these targets, we have medicines. So with these medicines, the life is so easy, the treatment side effects are less, and life is prolonged. So now, after this targeted therapy, now we have immunotherapy in lung cancer. If the patients are having PDL1 test, what we do for these cases, if it is strongly positive, these patients respond very well to immunotherapy. So in last 20 years, we have seen significant change and significant improvement in survival from chemotherapy to targeted therapy and now with immunotherapy. So definitely the treatment landscape has changed, and we have better results compared to what we are doing 20 years back. Sorry, you are not audible.
Sorry, sir. When
Yeah.
you talked about the treatment landscape change, and when we talk about this conventional or traditional chemotherapy, how far it is different from immunotherapy and targeted therapy, sir?
The way of working is different. Chemotherapy
Mm.
mainly it works by killing cells, mainly killing by cancer cells, as well as it kills normal cell as also. Targeted therapy that works on specific targets, like I said, EGFR.
Mm.
If the EGFR mutation is positive, that medicine will work in those cases only. If it is non-mutated, it will not work. Similarly, immunotherapy, if the target, the PDL1 positivity is there, these patients respond very well to immunotherapy. The immunity medicine, what we give, response is good in these cases. So, chemotherapy main action is killing cells. Targeted therapy, they see target in our body and they work on that. Immunotherapy, that again work on, you can say, target.
Okay. So the slowly the quality of life is not compromised. It is
Yes, definitely.
because of
With the
this
targeted
available
therapy,
therapy.
the side effects are very less. With immunotherapy, side effects are very less compared to chemotherapy. The hair loss, what normally people are worried about, is not there with targeted therapy as well as with immunotherapy. Loose stools, getting low TLCs, counts, and all that. That side effects are not seen with this targeted therapy or in with the immunotherapy. So definitely, the side effects are much less as compared to chemotherapy.
Okay. And sir, you talk always. There is one point is that affordability. So how far this targeted therapy and whatever the immunotherapy is affordable to the patients?
Targeted therapy definitely now people are able to afford because now we have a generic medicine for that, mainly EGFR. So targeted therapy cost is not much, and government support program they also offer these targeted therapies. So getting targeted therapy for these our patients is not a difficult task. Getting immunotherapy is difficult because the cost is too much and generic medicines are not available. So now many companies are trying to get immunotherapy generic version. So in near future, we may have generic immunotherapy, and then the cost will come down. So definitely in near future, we'll be able to use more immunotherapy as compared to today what we are doing.
So these many therapy options are there to treat a lung cancer patient, sir. So for example, for the patient, how does you personalize the treatment, sir? Treatment plan? Any
Uh,
example?
yes, once the patient is referred to us with a diagnosis of lung cancer or a differential of, you can say, query lung cancer. Then we get a biopsy done from the mass, as well as we'll try to get a CT scan or a CT scan done. Getting these reports, we'll come to know this is a lung cancer and what is the stage for this lung cancer. And then we get a genetic workup done for these cases, like genetic mutations, EGFR, L-cross, or PDL1 testing for these cases. If there is a target available, then we treat based on the targeted therapy. If target is not available, then we treat these cases with chemotherapy, plus minus some cases we add immunotherapy. Because of the cost of immunotherapy, we are not able to give to all patients, and so most of the patients, if the target is not available, they get chemotherapy. Chemotherapy cost is not much at present, and most of the government schemes which are available at present, they give all type of chemotherapy in their package. And targeted therapy, if it is there, then targeted therapy is also available. So these getting these diagnoses and basic treatment is not costly. People are able to afford it, but getting immunotherapy is definitely not in their budget.
Okay. And when we talk about this quality cancer care in India, sir, so what are the major barriers you see for this assessing quality care from
Uh,
your advice? I mean to say,
the main problem what we see is awareness. People are not aware that these cancers are curable. They should be treated. So normally, once they come to know they have lung cancer, they they try to avoid treatment because they feel it is not curable, and they just stay at home. So this part is lacking. So we need to work on this. That these patients should be aware that lung cancer is treatable, and in early stages it is curable. And one more stigma is there that smoking is related to lung cancer. So once the patient come to know they have a lung cancer, everyone asks either you are smoker or not. So that stigma comes with lung cancer. These people feel that we may have done something wrong, not smoker, but we have done something wrong. That's why that cancer has come up. So social stigma is also attached with all malignancies. Specifically, we can say lung cancer, because smoking is linked with the lung cancer. So that challenge we are facing. Otherwise, quality care in tier 2, tier 3 cities is difficult because most of the immunohistochemistry markers are not available in these places. And getting sometimes biopsy reporting is also not adequate. So getting these reports from better cities like tier 1 cities, it takes time, and sometimes people don't do that. So I feel that everyone should get testing from a NABL accredited lab, where all immunohistochemistry markers and this PDL1 testing or genetic testing are available. So these biopsies should be done at those places. In some small cities, PET scan is also not available, and some part of the country, radiation machines are not available. So these problems are there in our small tier 2, tier 3 cities. So these government need to take care of these things. So getting these CT scan, PET scan, and this radiotherapy machines in tier 2, tier 3 cities.
Sir, my next question was that only. How does this private and public should take care of this? But you already answered that, sir. But one more thing, sir. As you see many tier 2 city patients, so what advice you give to the tier 2 city patient for the navigation of the treatment? Any advice for that
Uh,
particular patient, sir?
Mainly, the thing is that I already mentioned that getting treatment in tier 2 city is not difficult. In our city, we can say in
Hmm.
Bathinda, most of the things are available. So PET scan is available, then radiotherapy machine is available, but like genetic test is not available, but we can get it done from higher cities like from Delhi or Mumbai. We can get it done. So all the things are available. Patients can choose a online consultation from a higher centers. Second opinion, you can say second opinion from the higher centers. But if the treatment is available in nearby city, then they should go for nearby treatment only, because chemotherapy sessions are there every time. They have to go to higher cities, and in between they get some toxicity. So getting treatment for toxicity and then running for 200 kilometers, 300 kilometers is not easy. So in tier 2
Yes.
cities, I think chemotherapy part can be managed. Surgical part, sometimes it is difficult because getting lung surgery done is not feasible in small cities. So surgeries can be done in tier 1 cities, and chemotherapy radiation, if it is available, then preferably these should be done at nearby place only.
Sir, anyways, you talked about this stigma also. Meanwhile, when you are
Yeah,
discussing about this, but still, you still feel that there should be a mental support required for the patient. How does the
definitely.
psychosocial impact will be there on that?
Definitely, all cancer patients need psychological therapy for lung cancer as well, because these patients, they have a fear of death. Some, they have anxiety, fear of death, anxiety of getting disease progression, anxiety because of the pain, and they normally do not get adequate sleep, and some side effects. Because of the side effects, they are not able to have good food, then appetite is lost. So these issues are there, so they need support from the family members as well as the friends, and some psychological support from a qualified psychologist. So these are definitely requirement, and most of the places these services are not available. So this part is missing, and it's not cared as it is required.
As you rightly said, sir, cancer is a word which not only affects the individual but also affects the entire family.
Yeah.
Yeah. And
And
sir, connecting to this, sir, please.
yeah, financial issue is also there because the cost of the treatment, cost of the diagnostic is very heavy. So most of the patients, families, they are not able to cope up. So financial burden again gives stress to the family.
Anyway, sir, what kind of role these caregivers will take in overall treatment journey?
Caregivers, I think, first of all, they should be counseled that
Yeah.
they are the support to the patient. So they should not be depressed, or they should not be they themselves should be in good health or good mental state, so that they can take care of the patient well. And they should not treat patient like that is a burden to them, financial, or they are sometimes burnt out because multiple hospital visits, multiple times at home they need to take care of the patient. Sometimes patients are not able to sleep, then they have to be with them for support system for feed and all that, foods. So first of all, caregivers should be counseled that they should be mentally strong to cope up this deadly disease.
Yes. So in my starting of talk, if you remember, I told that a lot of misconceptions are there. So, what kind of misconception or what kind of myth you find in your experience when patient talks about in lung cancer?
Can you repeat? I didn't get the question.
Based upon your experience, what was the most common misconception people will talk to you, sir, about lung cancer? Misconception or maybe myth, whatever it is.
Um, Most importantly, I think once they get the diagnosis of lung cancer, their first thing is that it is not curable, it is a dead end. So they don't get treatment.
Mm.
And second is getting treatment is very difficult. The patient will not tolerate chemotherapy or surgery. So that part is also important. Most of the people feel that patient is not fit for chemotherapy and they will not get any benefit with the treatment. So convincing them that they should get the proper treatment and it may be curative or with the treatment life can be prolonged. So is very difficult. So main concern is the thought process of the patient and their relative that cancer is a dead end and nothing can be done for the patient. So that myth is the problem.
Yeah. So connecting to that only, a lot of expertise of your expert opinion. In your experience, what give you the hope while treating a lung cancer patient, sir? Just one hope.
Hope is that cancer is curable in stage
Yes.
1 and 2. Definitely it is curable. 3 is also curable. In stage 4, definitely we can prolong the life, and if the treatment response is good, they can have a quality of life as well. So this is the main hope. And quitting smoking is very important. Sometimes people they continue to smoke even on treatment, so that part is also important. So we try to keep we try to tell the patient and their family members that we need to quit smoking, but that is a challenge in treating these patients. uh, that's all.
Okay. And anyway, sir, when you talk about you're always giving advices to the general audience, but one strong advice if you want to give for the general audience, what would be one strong advice or
uh,
powerful message for the audience?
Keeping health is very important. So we need to have a healthy lifestyle, like good exercise, good food, no smoking, no alcohol. We need to cope up. We need to take care of our air pollution because that is a big challenge in metro cities. So and these things, yeah. So air
Thank you,
pollution
sir.
we need
Thanks
to
for your
take care.
valuable time.
Yeah.
Thank
Okay.
you,
Thank
sir.
you.
Thanks for
Thank
your
you. Thank you
valuable
very
time
much.
and
Thank you.
joining
Thank
in
you,
this
Mr. Anuj.
platform. And thanks, Voice of Healthcare team. And thank you once again, sir. You have really enlightened us and you have thrown some light about this lung cancer awareness. And you also given your expertise and whatever required for the patient or for the general audience. Thank you very much, sir. Next time in the same podcast, we can meet on other awareness programs, sir. We generally require your time for that also. Thank you, sir. Thank you
Definitely.
very much.
Definitely. Right. Thank you. Thank you. Thanks a lot.
Thank you. Rahul, you can end the session.